Hello everyone, I am Dr. Chen Xiaoqing. Today we will talk about the innovations in handheld ultrasound, the current state and future prospects. I am an emergency physician at Changbing Shouchuan Memorial Hospital and also the director of the ultrasound training program at IARCAT Taiwan. At IARCAT Taiwan, we hold over 120 ultrasound workshops each year, training more than 2,000 participants annually. The trainees include both physicians and non-physicians. Our training courses cover everything from head to toe, such as transcranial ultrasound to musculoskeletal ultrasound, all of which are part of our teaching content. In addition to being an emergency physician and the director of the ultrasound program, I also serve as a technical advisor for Compal Electronics Corporation's subsidiary, ACO SmartCare. Regarding the evolution of ultrasound, ever since the discovery of the piezoelectric effect in 1881, the development of ultrasound has flourished. It began in 1914 after the Titanic sank, when people discovered that sonar could be used to detect underwater reefs or icebergs. However, it wasn't until the 1940s that ultrasound began to be applied in medicine. At that time, ultrasound machines were about the size of a classroom, and it wasn't until the 1950s that their size started to shrink. In 2017, Butterfly launched the world's first handheld wired ultrasound, and in 2020, ACO SmartCare also released a series of wireless handheld ultrasound devices. The progress of handheld ultrasound has now reached a bottleneck, and its functionality must be enhanced with artificial intelligence, AI. The evolution of AI not only enhances handheld ultrasound but also adds many real-time computational functions to large-scale machines, helping doctors quickly find the direction for diagnosis. For example, during resuscitation, we can use AI to quickly determine the position of chest compressions, adjust the location, and thus create the maximum cardiac output. This research has also been published successively in world-renowned journals. Regarding the evolution of handheld ultrasound devices, various types of ultrasound probes have already become standard. Currently, ACO SmartCare Ultrasound is the only machine on the market fully equipped with features like wireless transmission, IP67 waterproof rating, long battery life, and complete machine disinfection and cleaning capabilities. The new generation of ACO SmartCare Ultrasound model, NEO, is already capable of performing cardiac ultrasound calculations. You can observe in the video that the interpretation of the endocardium is quite impressive. At the same time, ACO SmartCare Ultrasound also features intelligent computing capabilities, such as automatic calculation of blood flow velocity. Therefore, when examining carotid ultrasound, the machine can automatically record the maximum blood flow velocity, eliminating the need for manual calculations and significantly improving workflow. Additionally, the ACO SmartCare Ultrasound also has the capability to automatically calculate post-void residual bladder volume. As for vascular puncture, the ACO SmartCare Ultrasound is equipped with enhanced needle imaging capabilities. You can easily identify the position of the puncture needle within the tissue on the screen, assisting doctors or nurses in accurately guiding the vascular puncture needle to the correct location. The lipo measurement. This feature is used to automatically detect the location and measure the thickness of subcutaneous fat. This facilitates rapid evaluation of the patient's obesity level, cardiovascular risk, and metabolic health status, providing precise monitoring of patient changes over time. The Auto-EF. This feature involves the automatic calculation of the ejection fraction, end diastolic volume, and end systolic volume of the heart. EF is a key parameter for assessing left ventricular systolic function. Integrating this feature into the ultrasound system ensures accurate and consistent measurements, reducing human error and improving the efficiency of cardiac function assessment. DDH. Unlike traditional methods for measuring and calculating DDH, ACO SmartCare utilizes AI for automatic calculation, quickly analyzing joint angles and providing accurate diagnostic data. It also standardizes the data to avoid discrepancies caused by variations in individual doctors' experiences or methods. In addition to the enhancement of artificial intelligence, the Apache machine also features mixed reality application functionality. Users can complete various operations on the machine, such as adjusting depth, brightness, capturing single images or videos, and switching between M mode, color mode, or pulse wave Doppler without having to touch the tablet. Additionally, through mixed reality, users can integrate information from both HIS and PACS into their field of view simultaneously, making it more efficient for doctors to treat patients. This platform is not only available on MetaQuest, but also on Apple Vision, both of which have the same interface ready for use. Our efforts are primarily aimed at improving patient care and making it more reliable. So far, ultrasound is the only diagnostic tool that can satisfy all 6 dimensions of the healthcare matrix. With no radiation, the ability to be repeated, convenience, effectiveness, and a patient-centered approach, ultrasound can help discover and solve patients' problems. The following are some clinical diagnostic cases in which the Sichuan healthcare system collaborated with Ako SmartCare handheld ultrasound. The first case is a 54-year-old female who came to the emergency room complaining of nausea, vomiting, and right upper abdominal pain for 4 hours. On the ultrasound, you can clearly see that the long axis of the gallbladder is greater than 8 cm and the short axis is greater than 4 cm. At the same time, you can also see a stone in the gallbladder duct, which is a typical case of cholecystitis caused by gallstone obstruction. The second case is a 40-year-old female with a history of ovarian cancer surgery 20 years ago. She has been vomiting continuously for the past day, including bile. When she came to the emergency room, her abdomen was distended and painful, with obvious percussion tenderness and a dull sound on auscultation. On the ultrasound, you can see her small intestine is very swollen, and the chyme inside is unable to move down smoothly. Additionally, her stomach is also highly distended, which is a typical case of intestinal obstruction. The third case is a 22-year-old male who suddenly experienced severe left-sided chest pain 3 hours ago. When he arrived at the emergency room, he was also experiencing shortness of breath and dizziness. We found through a lung ultrasound that the patient's left chest had no pleural sliding. In addition, the spleen area showed no clear curtain sign. This is a typical case of pneumothorax. The fourth case is a 55-year-old male with poorly controlled diabetes who came to the emergency room after having a continuous fever for 2 weeks, combined with abdominal distension and loss of appetite. On the ultrasound, you can see multiple irregular and cloudy cystic lesions in the liver, some dark and some bright, which is typical of a liver abscess. The fifth case is a 90-year-old male who had a persistent fever over the past 2 days, along with thick sputum. Upon arrival at the hospital, he was unconscious and had low blood oxygen levels. On the ultrasound, we clearly observed fragmented and irregular pleural lines along with numerous B lines in his lungs, which are typical ultrasound signs of pneumonia. The sixth case is a 71-year-old female with a history of lung cancer who had been experiencing shortness of breath, general weakness, and night sweats for the past 4 days. In the emergency ultrasound, we found a large amount of pericardial effusion, which had already compressed the right ventricle, making this a case of cardiac tamponade. After performing a pericardiocentesis in the emergency room, the patient's condition stabilized. The seventh case is a 66-year-old female with a history of liver cancer. Over the past week, she experienced severe abdominal distension and loss of appetite. On the ultrasound, we could clearly see the distension of the patient's splenic vein, and the portal vein was filled with thrombosis, indicating a case of liver cancer complicated by portal vein thrombosis. Under the encouragement of President Huang, the Sichuan healthcare system has significantly increased the use of handheld ultrasound to replace other more costly examinations over the past 3 years. During this time, the ultrasound utilization rate has increased from 30% to 60%, and the number of emergency department visits has also risen significantly. However, the proportion of CT scans has not increased along with the rise in patient numbers. We have effectively increased the diagnosis of patients using handheld ultrasound while also reducing unnecessary carbon emissions. The future of handheld ultrasound will involve using AI technology to make ultrasound even more lightweight. For example, we could use patch-based ultrasound to help athletes monitor the effectiveness of muscle training and measure whether muscle mass has increased. For postpartum women, AI ultrasound could be used to monitor the recovery of abdominal rectus muscle separation after childbirth. One day, these technologies will be integrated into wearable devices and enter households. In the future, ultrasound will no longer be limited to healthcare professionals. People who are health conscious or subacute patients will be able to use ultrasound to monitor their own health and promote well-being. Thank you.